Get Mom Strong friends. My name is Jeanice Mitchell and I'm a pelvic health physical therapist. Have you ever wondered about pelvic organ prolapse and how to check for a vaginal bulge? Well, stay tuned. Here's a female pelvis, which is kind of like a bowl. The bones form the outside of the bowl, and the bottom of the bowl are the pelvic floor muscles, literally the floor of your pelvis. So they connect at the pubic bone in the front and then stretch all the way back to the tailbone in the back. They also stretch side to side. In this view from below, let's identify the three openings. So you have the urethra where urine exits, you have the vagina, and then you have the anus where poop exits. One very important job of the pelvic floor is to support, so they support the pelvic organs. In this pretend pelvis here, we have the pelvic floor, and you can see three organs generally in females. We have the bladder, the uterus, and the rectum. So the pelvic floor muscles are supporting these organs. Here's a pelvic floor that is not doing a very good job of supporting the organs. See how much it's sagging? The pelvic floor muscles must stretch up to 245% during a vaginal delivery. Studies also show that up to 50% of women lose some of the supporting function of the pelvic floor due to childbirth. This loss of support can result in pelvic organ prolapse, which is the descent or falling of the pelvic organs into or through the vaginal canal. It's important to recognize the signs and symptoms of pelvic organ prolapse. Some of the most common symptoms are pelvic heaviness, pelvic pressure, and vaginal bulging. Let's talk about what to look for. So it's going to be a little pink bulge. It's actually the vaginal tissue that you're seeing. So if it's the bladder, it's not going to be yellow, it's going to be pinkish because it's the bladder that's actually falling into the vaginal wall and collapsing. If it's the rectum, it's not going to be brown, it's going to be pinkish because it's the rectum that's falling into the vaginal wall. And same thing for the uterus, it'll be pinkish. Here's a simulation of what to look for. So this is a simulated vaginal canal and this is a simulated bulge. Okay, so it may be very, very difficult to see. It may be high in the vagina, which is great, or it might be at the opening of the vagina, or it might even come out of the vagina. Find a comfortable supportive position with back support and leg support. A bathtub is a great option, but wherever you have privacy and support is fine. You take a handheld mirror, and we're taking that mirror to look at the perineum to help guide us so that we can see what we're doing and what we're looking for. Okay? So with the mirror continuing to guide you, you'll take your hand and you're separating the labia. So you're gently separating the labia and we're looking for the vaginal opening, which is right there. So with my mirror, I'm going to watch that vaginal opening and I'll cough. And as I cough, I'm watching to see if I see a bulge in the vagina. Let's repeat that in standing with your foot on a step stool. Using your mirror to guide you, you separate the labia, identify the vagina, and cough. You're watching for the bulge. Symptoms may vary based on the time of the day. Symptoms may vary based on activity. Symptoms may vary based on the time of the month. I encourage you to keep a journal and record your symptoms, when they occurred, what you were doing, and the time of the month. Your women's health provider is the provider that can accurately diagnose pelvic organ prolapse. So if you have a vaginal bulge, I encourage you to let your women's health provider know and get checked. Exercise is a huge component of healthy pelvic floor muscles and a healthy life. I'm so glad that you've joined Ashley in the Get Mom Strong movement. I encourage you to listen to your body and to support your pelvic floor muscles. If you have any questions or if you need additional resources, please feel free to reach out to me. It is possible to reverse or reduce pelvic organ prolapse symptoms and to live a high-quality, active, happy life. I know because I've had pelvic organ prolapse for 19 years. Thank you so much for joining me. I hope that this has given you information, hope, and help.